Well, we usually associate February with hearts because of Valentine's Day, but the month is also dedicated to taking care of our real hearts. Cardiovascular disease is the leading cause of death among both men and women in the United States, according to the CDC.
February is National Heart Month, and here to help raise awareness is Dr. Raed Bargout. He's the chief of radiology with Dignity Health Glendale Memorial Hospital. Thank you for coming in.
Cardiology.
Thank you.
Yes.
Yeah. What did I say?
Radiology.
I said radiology?
Close enough.
Sorry about that. Not even close. So heart attacks for men and women are usually different. How so?
Well, first of all, thank you for having me here. This is an important topic to talk about. As Lou pointed out correctly, heart disease does not only kill the most in men, but it is #1 killer for women as well. More than all cancer combined, more than ovarian and breast cancer and colon cancer. Now, the symptoms usually in women is a little bit different than men. It's still most commonly chest pain that radiate to the left arm and left shoulder, but women can have usually shortness of breath. The chest pain can radiate to the back in between the shoulder blades. They can have jaw pain, sometimes excessive fatigue, just tiredness that is out of the ordinary. Those are common manifestations in women. And as far as why men behave or the symptoms are different than women, actually no one knows why. We do know that coronary arteries are much smaller in women than men.
So how do you test for coronary disease, and do you go through a doctor to you as a cardiologist, or do people just call cardiologists straight and say, hey, I'm concerned about this heart, maybe I have a history of it? What advice do you have for viewers?
Well, the advice I have for everyone is do not wait until an event happens, because it might be too late after a heart attack, after a stroke. Do not wait for that damage to happen. You have to be an active participant in your health care and ask the right questions. The advice I have is basically 4. The first one is know your risk factors. So if you are diabetic, if you have a family history, if you are a smoker, stop smoking. Are you diabetic? #2 is keep your weight healthy. So there is something called body mass index, BMI. It's easy formula. You can find it online. You put in your weight and your height, and your BMI should be close to 25. The higher, the higher the risk. The third one is exercise. The minimum exercise recommended by the American College of Cardiology is 150 minutes per week. That means around 30 minutes every other day of brisk walking, jogging, running. And the fourth one, which is an essential one, is the diet. Stay away from processed food, from processed meat, carbohydrates, starch. On the other hand, eat more fish, vegetables, and fruit.
You got a big event coming up at Glendale Memorial Hospital concerning this.
Absolutely. Every year, Glendale Memorial has been serving the community of Glendale and surrounding areas for close to 100 years. And we take pride in providing this service back to the community. On the 13th of February, we have King and Queen Heart, which is an event that celebrate patients who's done great in terms of cardiac rehab, and at the same time we do offer free screening for heart disease, glucose, body fat index, as well as hypertension, and etc. So I encourage. It's
open to the public.
Absolutely, it's open to the public. Everyone is welcome to join us.
Yeah. All right. Well, thanks for coming in. And again, the Kings and Queens of Hearts event, it's free to the public. It's happening on the 13th of February. For more information, head to facebook.com/Glendale Memorial.
That's on a Thursday, February 13th.
Yes.
All right. Thank you so much. Appreciate it. All right. Let's